Today on Health Check, we will still be talking to Dr. Na Ashile Dodo, and we will be talking about scoliosis. My name is Nanama Anabempo. We'll be right back with you. Dr. Na, thank you for having us again today.
You're welcome, Nanama.
So today we are speaking about scoliosis. What is that?
So scoliosis is an abnormal side or lateral curve of the spine.
Mm-hmm.
Now, in a normal spine or in a normal healthy being, we'll see that the spine is usually very straight when you look at it from the front.
Mm-hmm.
But when you have scoliosis, instead of the straight spine, you may have something like this. So in layman's terms, we say a crooked spine, okay? Sometimes you can have it in one area of the spine, maybe just the upper to mid back. Sometimes it can be the entire spine. So from the upper back all the way to the waist area. So when the spine is so crooked or is bent that way, you can see that a lot of areas in your body can be affected.
Okay.
Because when you look at this chart here, from the top C1 all the way to L5, you realize that the nerves supply information to every single organ of the body.
Wow, okay.
From your hair all the way to the bottom of the feet. So when you have things like scoliosis and the spine is bent over that wide area, all the things that are associated to the area where the scoliosis is can be affected. So it can be very, very debilitating for a lot of people.
So how many people have it? Is it a common sickness or an illness?
So worldwide, they're saying about 3 to 4% of the population do have scoliosis. In the US, they're saying on a yearly basis, about 9 million people are diagnosed with some form of scoliosis. And there are varying degrees. So sometimes you can have an abnormal curve of 5%, which is a low curve or a low degree curve. It can go to 10%. It can go as high as 50, 60 percent of the abnormal curve as far as the degrees are concerned. So the more curved the spine is, the more severe your condition is. And the spine can curve so much. You can have somebody whose curve is literally like that. So when it's that severe, that is when the organs can literally collapse. So your lungs, your heart, your stomach, any of those organs, depending where they are as far as the spine is concerned, if they are not getting that information or the impulses because of the gross misalignment, those organs can virtually shut down.
Wow. So, I mean, with so many people having scoliosis, can we understand how you get the symptoms? Because I know that maybe in some of them, you mentioned the percentiles, but in some of them, the percentage may not be so high that you will see it.
Right.
But it could be progressively getting worse. So can you give us some signs and symptoms of scoliosis, please?
Great. So for this reason, we here at Nova Wellness Center strongly recommend that children should be checked for scoliosis at a very early age. Because like you're saying, sometimes the scoliosis is there, but you may not see it with your naked eyes. However, some of the most obvious signs are when you see people and their backs literally look curved. You know, people, you see them and it looks like they're walking funny, but really it's because they have an abnormal curve in the spine. Sometimes you have shoulder imbalance, so yes, one shoulder may be looking way higher than the other, or sometimes the shoulder blade itself would seem as if one is popping out more than the other one. We call it a rib hump. And then sometimes the hip area you see, so maybe you realize that your daughter or your son, when they wear a skirt, the skirt cannot stay even across the waist. Maybe it always looks funny. So all those are some visual signs that we use to check if people have scoliosis.
Okay. And you mentioned about children a lot. Would you say it's something that we must look into for children more than adults? Or, I mean, how is it something that you are born with, or it can just happen?
Great question. So for most people, they have what we call idiopathic scoliosis. So idiopathic simply means we're not sure where it came from. It could be right from birth. It could be even a fall that happened. You know, children are growing, they're running, they're doing all sorts of things. A fall that happened earlier on in childhood can lead to scoliosis. So yes, some people are born with this condition, and some people also grow up and then it comes up. And then we also have what we call the degenerative scoliosis. So the degenerative scoliosis are elderly. As they get arthritis or these degenerative diseases, spondylosis, and the bones are not as strong, the bones are getting weak, then they start to bend. So that's also scoliosis that can develop. So the reason why we recommend it for children, or if we recommend children are checked for it, is that especially in the lower degree scoliosis, so let's say from 10 to 30 degrees, if it's caught early, we can use chiropractic adjustments, stretches, and some other therapies to help correct it. So long as the growth plates haven't fused, or so long as the child hasn't finished growing, because the normal growth process would include that child getting elongated, or their spine getting elongated. So as you put in the right forces in that child, then it's very possible the spine can go back to normal.
Okay.
But if you wait till bones have finished growing and you are no longer getting any elongation in the spine, it becomes harder to fix or correct scoliosis. So that's why we recommend that kids get evaluated earlier on in life. So long as it's before age 17, 18, thereabout, when the growth plates usually fuse, there's a lot we can do to help.
Okay, great. So I was watching something, a little girl, she had, I say little girl, but she had 48 degree, scoliosis, and then she ended up having to have surgery, and I think she had pins put in. But other than surgery, which I would also say possibly maybe the last option, what other treatment options do we have for that?
So first of all, we strongly recommend that people should have some stretches. So when you come in, even before we do the main thing, which is the chiropractic adjustment, we have some stretch therapy that our patients go through. Reason being that the spine is covered by a lot of soft tissue. So your muscles, your ligaments, the tendons, all those things cover the spine. And a lot of our daily activities cause those structures to become very stiff or very taut. So we do the stretches to help pull them out and loosen them up, so that when we do the adjustment, it really complements it very well. So stretch therapy is the first thing, and then after that we go ahead and do the chiropractic adjustment. That is our medication here at Nova Wellness Center. So we do the adjustments after we have looked at the spine, after we've seen the x-rays and all that. We can tell which individual spinal vertebrae are misaligned or have gone out of their normal place. So once we detect that, we use our hands to perform that specific adjustment on that individual vertebrae. So what it does is it takes away the pressure from the nerve. That way information from the brain can flow freely. Because when we have these spinal misalignments, think of it as a blockage for that, the impulses from the brain to reach its destination, and that can cause so many dysfunctions or so many problems for you. So it's extremely important that throughout your life, babies, middle age, elderly, you make sure you don't have any misalignments, which sometimes we also call subluxations. So we do the chiropractic adjustment to remove those misalignments. That way your nervous system functions better, and therefore all other organs also work optimally.
Okay, great. And then what else would You don't?
Then sometimes we'd also do some physiotherapy. Now the type of physiotherapy we do here is mainly for the pain control, because sometimes people are in so much pain that you can't even manipulate the spine. So we do some electrotherapy, and we put these pads on the area of severe pain, run a very gentle electrical current, and that alone helps to reduce the pain, so that the doctor is able to manipulate the spine to remove any pressure from the nerves.
Okay. So you put the pads on, and then it gives the opportunity for you to be able to. Does the alignment make noise? I heard it makes noise.
Sometimes, not 100% of the time, but sometimes when we do the adjustment, you hear some funny noises.
Okay.
It's nothing scary. What it is that as you're breathing in and out, some gases get stuck in your joints, okay? So when we put the body in certain positions and we do the adjustment, you may hear those gases just being given off, and it sounds like a crackling noise, kind of like when you crack your knuckles. Okay. Yes, so those are the types of noises that not 100% of the time, sometimes you would hear.
Okay. Yes. And then what else do we have?
And then lastly, massage. We always say here that massage is not a luxury. A lot of people think it's only for the rich and famous, but we use deep tissue massage and also hot stone therapy a lot here to complement the chiropractic adjustments, because like I said, sometimes muscles are so tensed. You know, I've seen people who have been in maybe a car accident 20 years ago, and they may have had some misalignment. So imagine your spine being misaligned for that long. The stiffness in those muscles. Sometimes you need a very, very deep tissue massage to help release those tightness in the muscles. So if we just focus on the spine and we're aligning the spine and those muscles are still tensed, we don't get the results. So that's why we go ahead and add massage therapy, and that really helps a lot of patients get out of pain.
Okay. Then I believe after that last is the surgery.
Yes, so we don't do surgery here at all. All our therapies here are natural. We use our hands and a few assisted devices. However, sometimes when patients come in, the problem may have already gotten out of our hands. Sometimes we may not be able to help them. So if need be, and the condition is so serious, then they may have to go for a referral with a neurosurgeon who would be able to advise further.
Okay. So what should one do if they find or they feel that maybe after everything that you've said, do I have it? What should one do?
So the first thing I would recommend is to have an evaluation done. If you suspect, based on what you've heard, you suspect your child or significant other or some loved one has scoliosis, then you want it to be properly evaluated. The evaluation would usually involve some x-rays, and it's through the x-rays that we calculate how severe or the angle of deviation. We call something the Kopp's angle. So we're able to calculate the Kopp's angle to see how bad the scoliosis is. So once you've done that evaluation and you know how bad it is, then you can look at the different types of treatments that can be done. We have the chiropractic treatment, we have exercises that help with the rehabilitation of the muscles and ligaments that may have been affected by the scoliosis. Then we also have the bracing, and then there's so many different things. Some physiotherapy, some massage therapy can also help with patients that have scoliosis. So I'll say the first thing is to be properly evaluated and checked, so long as you suspect it, so that the once it's diagnosed, the earlier the better, you can receive some treatments.
Okay, great. Dr. Now, I'm grateful for your time today. Thank you so much.
You're very welcome.
And that's the end for Health Check today. We've been talking about scoliosis. My name is Nanama Anabempong. See you again next time.